Foundation Module 9 UHS Modular Integrated Undergraduate Curriculum Physiology Sheikh Zayed Medical College Physiology Department. Dr. Sheen CEO and Founder Medical Superfast Simplified Physiology Video Lecture Notes. Guyton and Hall 14 Edition Lecture Number 15, Integrate with Pulmonology. Learning Objectives. Discuss FEV1/FVC ratio in relation to bronchial asthma. The FEV1/FVC ratio, forced expiratory volume in 1 second/forced vital capacity, is an important parameter used in the diagnosis and assessment of lung function with respiratory disorders, particularly in diseases like bronchial asthma. In bronchial asthma, the airways becomes inflamed, constricted, and obstructed, leading to difficulty in breathing. This airflow obstruction is typically reversible either spontaneously or with the use of bronchodilator medications. The FEV1/FVC ratio is a key indicator of airflow obstruction in asthma. FEV1, forced expiratory volume in 1 second. This measures the amount of air a person can forcefully exhale in the first second of a breath. FVC, forced vital capacity. This is the total amount of air a person can exhale forcefully after taking a deep breath. The FEV1/FVC ratio compares the two values to assess the efficiency of airflow through the airways. In bronchial asthma. Normal range. In healthy individuals, the FEV1/FVC ratio is typically 75 to 80% or higher, meaning that most of the air is expelled in the first second of exhalation. Asthma effect. In asthma, due to airway inflammation, bronchoconstriction, and mucus plugging, there is obstruction to airflow, particularly during exhalation. The FEV1/FVC ratio in asthma patients can vary significantly, both within a single day and between different days. This leads to a reduced FEV1, as patients cannot expel air as rapidly due to narrowed airways. The FVC may be relatively preserved or mildly reduced, but not as much as FEV1. Factors such as exposure to triggers, use of bronchodilators, and level of disease control can influence the FEV1/FVC ratio in asthma patients. A reduced FEV1/FVC ratio, typically less than 0.7 or 70%, is one of the diagnostic criteria for bronchial asthma. Therefore, the FEV1/FVC ratio decreases, indicating airflow obstruction. Thus, the FEV1/FVC ratio is a critical tool in identifying and managing asthma, particularly in differentiating it from other obstructive lung diseases.